See, walking, we all know walking. How do we walk? What are the muscles involved? It's a different question. What is ideal walking? Nobody has defined so far. Walking is a complex phenomenon. In this technological era, how the body moves forward has not been decoded. Gait analysis analyzes the way we move forward. But what is ideal? It is still not been decided. Walking as a subject is not taught as a children. Have you ever thought that how to walk correctly? We walk incidentally after 1 or 2 years, and nobody teaches us how we walk. Yes, we feel it is correct. It is not taught even to the medical students. As an orthopedicians, we know a lot of abnormal gaits, normal gaits. Nobody has taught us. Nobody has think that we have to teach normal gait. What is life? Eating, working, and walking are the basic criteria of life. We are experts in eating. We have so many dishes and everything. We are expert in working. We have so many professionals. Walking, you say that I am lost to walk. I don't want to walk. How walking is described? Bradford, founder of JBJS, described in 1897. He describes walking as, by the action of the muscles, the thigh is advanced forward by the action of the iliacus, tensor vagina, and rectus muscles. Body's weight is thrown on the heel, and the body is brought forward by the push of the foot of the rear of the leg. In a slow gait and feeble persons, in children, weight of the body is used as a means of propulsion. When you put the leg forward, the weight of the body allows, because of the forward bending, to move forward. He classifies the gait into erect gait and a passive gait. Active gait, in which the muscles are used for the forward, and the passive gait, which uses the body weight for the movement of the body. How a gait analysis describes walking. Normal walking is defined as a highly controlled, coordinated, repeated series of limb movements whose function is to advance the body safely from place to place with a minimum expenditure of energy. This is an explanation. All normal persons are walking is highly controlled. How highly controlled? It is not defined. What is minimum expenditure of energy? That is also not defined. Let us go to the anatomy. Gray's anatomy description of the lower limbs as abduction, adduction, flexion, extension, internal rotation, and external rotation. Have you ever adducted during walking? You don't. You just adduct. You just walk. Abduction, we have such a big muscles, gluteus maximus. Why do you require abduction? We don't, isn't it? Internal rotation, external rotation. What is the significance to our movement? It is not been described. Adductor muscles, how many times we adduct? Why there are so many adductors are there? Plantar flexion, gastrocolius plantar flexes the ankle. But in reality, you just go walking. Do you plantar flex? If it is for to be plantar flex, you have to push the ground itself. Dorsiflexors, tibialis anterior, EHL, EDL, or dorsiflexors. Why do you need such a powerful muscles? What are the exact role in walking? Muscular actions with reference to the walking is not described in anatomy or any other books. PET-CT, I want to analyze the walking using a PET-CT. PET-CT is a gold standard in radiology that is used by radio-labeled glucose is injected into the body. It is used to identify the cancer tissues. What are the cancer tissues does it? There is a huge uptake of glucose, that's all. Because of hypercellular activity, there is a huge uptake of glucose. Therefore, there is a huge uptake, it is highly malignant. There was no uptake, it is a benign. That's all the tumor. Similarly, I use the same principle. Radiolabeled glucose is injected into the body. Person is made to walk for 1 hour, and the uptake is analyzed using a PET-CT machine. PET-CT analysis provides the quantitative uptake of the glucose by the individual muscles. Unlike in any other gait analysis tools, It analyzes the whole muscle from origin to insertion. PET-CT analyzes the full stretch of muscles. Activity along the full length of muscle can be visualized. Muscular activity of the muscles across the length of the from origin to insertion can be analyzed. What are the things? This is, you can see the psoas major, it has got 1.5, minor, iliacus, sartorius. It's almost every muscle is acting in case of walking. Probably tensor fascial lata, even that is also acting so much. What is very interesting is there is a lot of activity in the adductor hallucis, abductor digiti minimi, flexor digitum longus, and other muscles. The activity is high in case of small muscles and activity is low in case of big muscles. Probably big muscles compensate because of the quantity. Walking theory. Findings of the PET-CT analysis are used to analyze the walking in detail. Some of the questions I raised previously were not answered in any textbooks or teachings. A lot of researchers have made their contribution in analyzing individual muscles. My walking theory is a culmination of all those dedicated researchers who have studied individual muscles in detail and my PET-CT analysis. According to me, human walking is defined as the propulsion of the body forward as a result of series of movements of the lower limbs by the systematic contraction of the muscles of the lower limb over the adaptive bony frame in a specified way with specific contraction of the hip, thigh, leg, and foot muscles to produce the forward movement of the body, maintaining stability, agility, and the speed. In the gait analysis, none of the theories describe what is perfect gait, what is a correct gait, what is an ideal gait, what are the muscles are used. They only analyze the gait, how we walk. And most of the gait analysis used in sportsman and CP. Even in the CP, you have to see after the gait analysis, you have to specifically analyze the action of the muscles. The surgeon has to analyze it specifically. Walking is subdivided into phases depending on the contraction of the muscle group of muscles actions it brings in moving the body forward. Here, I described how body propels forward by individual set of action of muscles. Each group of muscles plays an important role in moving the body forward. How I describe? This is almost swing phase and the stance phase. Movement of the lower limb is a swing phase. Movement of the trunk is a stance phase. But finally, all joints need to be stabilized during various phases of walking. Movement of the phase is akin to swing phase. We explain the individual group of muscles activity to bring the movement of the lower limb forward. Movement of the lower limb can be divided into two phases. It is, in the older days, walking is defined as heel strike, foot flat, heel off, toe off. The present day classification, they may uses a lot of sub-classifications, but heel strike, foot flat, heel off, toe off can be visualized easily without any use of technology or videographic analysis. Therefore, I have kept that as a standard. Movement of the body can be movement of the lower limb can be divided into two phases. From the toe off phase to foot flat phase, phase 1, and foot flat phase 2, just before the heel strike phase. This is depending on the action of the muscles. Lower limb in the first phase extends from the foot flat phase to toe off phase to foot flat phase. Iliopsoas muscles pull the femur internally. Tensor fascial lata, sartorius pull the femur tibia externally. Tensor fascial lata with its unique attachment to the iliotibial band assists the pulling of the femur. You can see here. So as major and minor, how it systematically attaches. This is useful, and then tensor fascial lata and the sartorius pulls the leg. See how thick the iliopsoas muscle. This is a PET-CT photograph. How thick the muscles. See how much activity is there in case of iliopsoas. Next phase is quite simple. The quadriceps takes over, extends from the foot flat phase to just before the heel strike phase in the swing phase. Quadriceps moves from the foot flat phase to the just before the heel strike phase. Movement of the trunk. Human body is designed extensively to move the body forward. According to me, it is the strength of the muscles that's important to move the body forward. Whatever may be the forces that is, it cannot move. If it were to be there, all persons should have been moved ideally. The strength depends in the call levies. We can't walk like that. And that's all. In case of old age, they cannot move without this. Probability. Human body is designed extensively to move the body forward. Every bone, muscle, and joints and actions assist to forward movement. Foot is the only contact point of the body. All muscles act. Foot is the only contact point of the body. Bony design provide sufficient leverage actions for efficiency of energy. The origin of insertions of the muscles assist specific activity to move the body forward systematically. Movement of the trunk is divided into several phases. One is the heel strike phase, heel strike to foot flat phase, initial heel off phase, late heel off phase, extension of the knee, pushing phase of the pelvis, and the pulling phase of the pelvis. Heel strike phase. Tibialis anterior, extension hallucis longus, extension digitorum longus, dorsiflexus the ankle. In the movement of the lower limb, the quadriceps moves the full lower limb forward. And there is an extension of the knee, ankle flexes the foot to the ankle, so that heel strike phase of the lower limb acts as a single bony column. The tibialis anterior, EHL and EDL, the strike the ground. Striking the heel by the contraction of the dorsiflexors, it strikes at the calcaneum. Calcaneum is fixed to the ground. You can see, calcaneum is fixed to the ground. You can see a pole vaulter. How does it move? He fixes the pole to the ground. At the time, the top portion of the pole vaulter moves it forward. Similarly, when you strike the heel on the calcaneum, the upper part of the body moves forward. You can see how much tibialis anterior is acting. This is a PET-CT photograph. This is a PET-CT photograph, how it's acting. You can see this. This is the tibialis anterior, EHL and ADL. Then from the heel strike to the foot flat phase. Heel strike move the pelvis forward, but the pelvis is so heavy with all the organs of the body, because you can see the pelvis is fixed, is a rigid organ. It is fixed anteriorly to the pubic symphysis, and the laterally by the hip joint, and the posteriorly by the sacroiliac joint. It's a huge, it's a misnomer to say pelvis as a pelvis. What is a pelvis means? Pelvis is a cavity. No, it is a chassis. According to us, according to me, it is a chassis over which your vertebral column is fixed, your ribs are fixed, your head is fixed, over which the body moves, the lower limb moves. For all gynecologists and surgeons, it is a chassis. It's a pelvis is called cavity. We have so many adductors. Heel strikes move the pelvis forward, but the pelvis is heavy with all the organs of the body. Pelvis needs to be pulled forward. Foot is brought to the foot place by the FHL and the plant of FHL. Adductor groups with its unique attachments pulls the pelvis forward. The abductor group of the muscles, adductor groups of the muscles attach to the pelvic rami. The lower limb glides over the head of the smooth talus. See here, adductor muscles, it arises in the center of the femur, typically attaches to the pubic rami and pubic symphysis. See here, you can see this is a PET-CT analysis. You can see this is a bladder where there is so much of activity. The muscles pulls the pubic rami. pubic rami, there is so much of activity. There is a huge blood supply is there. There is a reason why we can say that the adductor muscles pulls the body forward. See, so much. This is a bladder where the glucose uptake is so much. The same illumination means there is a hyperactivity at the pubic symphysis. That is due to pulling of the adductor muscles. Next comes the heel of the face. Plantar flexors, gastrocsoleus muscle plantar flexors the ankle. In reality, the heel lifts the whole body from the ground. Body weight shifts the forefoot by the action of the tendon Achilles. This shifting of the body at the ankle lengthens the lower limb and causes a passive flexion of the knee. This also raises the pelvis and assists the free movement. You can see plantar flexion. How much is there? There is a heel rise is there. Do you call it as a plantar flexion? No. Actually, the whole body is lifted up. There is a limitation for this lifting. It cannot lift further because the gastrocsoleus attaches to the calcaneum. It's the hind leg. And the late heel of face. Probably if we want to change some of the actions of the muscles, because it does not have a meaning in case of walking. Late heel of face. That is not sufficient. This heel rise is not sufficient to move the body forward. Action of the tendon Achilles do not lift the body sufficiently. There is a limitation in the plantar flexion. Tendon Achilles cannot lift the midfoot. This needs an assistance from the lift the hindfoot and the midfoot. Peroneus longus and brevis attaches to the cuneiform and both ends of the metatarsal bones. Tendon runs in the plantar surface of the foot. Thus, by the action of these muscles, the lift the body further. See here, the muscles, peroneus longus and brevis lift the whole body further. You can see this is the peroneus muscles, how much active it is. This is a PET CT and imaging. And you can see this much of lifting is possible. You can see ladies wearing a high heel. Everybody says high heel is not good, but still it is the action of the muscles that helps to wear the high heels. All this causes a passive extension of the knee. At the end of the heel of face, knee is flexed passively because there is a lengthening of the knees there. So that the whole weight of the body is shifted to the foot. This provides a stability and agility. Hamstring muscles pull the knee backward and extends the knee. Gluteus maximus attaches to the iliotibial band, helps to extend the knee joint. See here, as a result of plantar flexion, there is an increase in length. Hamstring muscles pull the knee from a passive flexion, pushing the face of the pelvis. At the end of the heel of face, by knee is pulled back, and the gluteus maximus extends the hip joint, therefore it is pushed. Iliotibial band. You should mention the iliotibial band. Iliotibial band originates the anterolateral iliac tubercle portion of the external lip of the iliac crest and inserted in the lateral condyle of the tibia. Gluteus maximus attached posteriorly and tensor fascia lata attaches anteriorly. This actually, in case of moving forward, tensor fascia uses the same iliotibial band to move the forward, and gluteus maximus uses the same tensor fascia lata backward. Pulling phase. You all come to San Francisco. Have you ever visited Lombard Street? Lombard Street? You not visited? Probably you must see. The steepest place in the San Francisco. It is a famous place. If you go up, you'll know that gluteus medius and minimus pulls up. Earth's surface is not on plane, but it is uneven. Walking in a hilly surface requires further pulling of the pelvis. Body needs upright at all times during walking. Gluteus medius and minimus attaches from the dorsal ilium and greater trochanter. The muscle tissue are arranged in group of fibers. Each group's fibers pull one another after other, which in turn pulls the pelvis in systematic way. This action helps to walk in a slopey areas. See here, you can see this is medius and minimus. It pulls the muscles very systematically. See how much it is there. This is a PET CT analysis. This has been recently released. Foot is the only contact point. Therefore, heel moves from heel strike to foot flat. Therefore, it needs to be walked in a straight line. Hence, the foot should move in a straight line. This achieves the goal of the energy efficient movement. Is it achieved? Therefore, all muscles need to be stabilized during this movement. The hip is stabilized by the external and internal rotators. Femur is stabilized by the semimembranous semitendinous popliteus. Ankle is stabilized. See, ankle is very important. This tibialis posterior, see how much activity is there, the PET-CT analysis. The tibialis posterior attaches in the middle of the intermuscular septum. This acts as a stabilizer of the ankle during the movements. Plantaris fascia is one important in case of dorsiflexion. It's a huge movement from almost 90 degree of movement is there in the ankle. Plantaris fascia acts as a tough fascia to prevent, to hold the foot in a stabilized way. You can see the adductor hallucis longus and abductor digiti minimi. These all work in case of, it holds in case of heel strike and a heel off phases. Walking is a complex phenomenon. Each group of muscles play an important role. Each joint is adapted to the walking. Ligaments provide stability to each. Bones provide transmission weight, levers to the action of the muscles. By walking in this way, I explained, provides a mechanical stimulus to all the muscles. Walking is the only solution to the lifestyle disease. According to the orthopedics, movement is life, life is movement. Movement has changed from walking to airport, missiles, whatnot, everything is there. Therefore, walking is life. Walking in the way explains provides mechanical stimulus to all group of muscles. It increases muscle bulk, increase the glucose and fat expenditure. Increased bulk of the muscles have a good role in case of, actually, right walking keeps the body into a virtuous cycle of health. Therefore, walking should be like this. I think all are hungry or they want to go. Any questions? We really have to move on because they're going to close the doors. Okay? Thank you.